Well, good Monday to you, Texas. You know it's going to be a great show if Scott Jones is in the house, and you and your executive chef of Cafe Italia, Tom Slatter, with us. What are you guys making for us?
Well, I've got a super duper drink to make. We'll get to that later.
Okay.
And we've got a grilled shrimp salad coming up.
Fabulous, Tom. Okay, looking forward to that. And I'm so excited to have Dr. Raul Rodriguez back on the show with us today. We will be taking your phone calls about fillers. Yes, you've heard it. Restylane, which is the big one everybody's talking about right now. So if we take your call on the air, you will get a Prezi. So give us a buzz right now.
Texas, it's time to jumpstart your week with TXCN's Texas lifestyle diva, Maddie Roberts. It's Mondays with Maddie.
Well, plastic surgery, while it can be highly effective in taking years off your face, involves risk, expense, and considerable downtime. More and more non-invasive procedures are gaining popularity, and one of the latest ones in the news is using the filler Restylane to literally plump up your lines and furrows. And Dr. Raul Rodriguez is back with us to talk about Restylane, and everybody's talking about this. It has been in the news for a while.
That's fantastic.
It's good stuff.
Good stuff.
And the difference is, let me move my coffee cup because that's Trey Tacky. I just realized that was something new. Kathleen Harrington's like, move your cup. It's tacky. Sorry about that.
That's okay.
Everybody's talking about it. It does what collagen used to do, only way better, and it lasts longer, right?
Right. Well, Restylane is a stabilized form of hyaluronic acid, which is a component of your body's own tissues. So it really blends nicely with your own tissues, fills in lines, wrinkles, grooves. It really makes you look younger for people who want a quick instant fix.
An instant fix, okay. And we've got an interesting an animation that shows it's kind of a cartoon of what it does in the skin right here. So you literally
As you can
stick it underneath where the lines
we can inject it any place where there's a depression in the skin, whether it be a deep fold, a wrinkle, or even the fine line. And by varying the depth at which I inject the filler, I can actually smooth out that area and make it look much smoother and younger appearing.
That's fantastic. And about how long does it last?
It lasts anywhere from about 6 to 9 months.
Oh, really?
Yes.
As opposed to collagen, which is maybe what, 3
Collagen
months?
may last 3 to 4 months.
Okay.
Right.
Okay. And no allergic reaction?
No allergic reactions. The nice thing about the Restylane is, since it is a component of your body's own tissues, it's very well tolerated by the body. You don't have to do any allergy testing. It really is nice.
Right.
Nice feeling.
Right. Okay, well now, let me just, I want to show, let's show the, I've got a little before and after picture too that I found off the Restylane site. And this woman looks like she's had a facelift, but all she did was, like you said, she just had the lines and furrows injected.
And this particular woman, she had the lines around from the nose to the corners of the mouth filled in with the Restylane. She had a little bit of lip enhancement, just very minimal, because we lose a little volume in our lips as we age. And just by restoring some of the volume to different areas of her face, you can see you made her look literally
10 years younger.
Yeah, 10 years younger.
That's amazing.
And that's something that can be done in the office in about an hour.
That's fantastic. Okay, so we want to take your calls right now. If you're curious about this and you have a question for Dr. Rodriguez, give us a buzz at 877-977-TXCN. If we take your call, you will get a Prezi, because I have this whole box of fabulous Prezis over here that I want to give away. Make sure you only call me 8 a.m. show, though, okay? Now, let's take a look at, because I don't want to talk about something, suggest something to our viewers that I didn't want to try myself. So
Absolutely.
I had you do these lines. And this is, you're giving me a dental block. It's a lidocaine block?
Yeah, one of the things I like to do, Maddie, is I believe in no pain.
I believe in no pain, too. And that's the nice thing about this. This didn't even hurt. I couldn't even feel it.
Right. So I do blocks so that the procedure is very comfortable. A lot of people have needle phobia. They're afraid of needles. But as you can see, it's not an uncomfortable procedure at all. I didn't even flinch. It
was no big deal. That's the amazing part about it.
Right.
It was just no big deal.
Right. A lot of people are surprised because they're afraid of the pain.
Okay, come here. Right here. Okay, look at this. All right, look, come a little closer. I usually hate doing this. Come in just a little close. Look closer. Look closer. Look closer. Okay, watch this. Smile. See their lines? And then they go away. Smile. See the lines right there? That's what he filled? And then they go away. Ha, 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 ha. I don't have any lines.
That's pretty good. Nobody likes lines.
I tell you what, I think this is really good stuff. And that was just one of those annoying little things.
Right,
I didn't really like that so much.
And one of the things that I try to impress upon patients is there's a lot of things with extreme makeovers.
Yeah.
And effective makeovers don't have to be extreme. Just by doing a few little subtle things, you can really enhance somebody's appearance dramatically.
Well, and that's what you do in so much of the rest of your practice, because you do the laser rejuvenation, you do mesotherapy, you do Botox.
Exactly.
These are all things that have no downtime.
Exactly. And most people are busy working people like we are, and they just don't want to take 2 or 3 weeks off to
Well, yeah, and
recuperate.
it's like I can show up on Monday morning with, you know, bandages and my eyes all swollen and that kind of thing. Now, we do have a call. Speaking of mesotherapy, Louise from Arlington has a call for us. Louise, hi, what's your call?
Hi,
What's your question?
Maddie and Dr. Raul.
Hi.
I would like to know, you're saying this Restylane is like something that is from our bodies, something from our systems. But is this something that is man-made, or is this something that is drawn from our bodies and then re-injected, or what is the process on it?
Right. No, that's a very good question. It's man-made, but the consistency of it, the composition is identical to what you have in your body, and it's stabilized so that it sticks around for several months. It doesn't get just absorbed immediately. So that's a good question.
It is, you don't have any allergic reactions? That's 100%, you think?
Absolutely not. That's the neat thing about it. Since it's man-made, there's no chance for infection, there's no viruses, there's no chance for allergic reactions to really speak of. So it's very, very well tolerated by the body. That's why it's such an exciting new filler to hit the market.
That's great. Well, Louise, I've got a couple of prezzies here. Are you more interested in skin things or hair things?
Skin things.
Skin things. Okay. Well, I've got some great products here. I'm gonna pull a couple of these for you, and be beautiful, baby. Thank you so much for calling.
And thank you.
Okay. Now, we will be taking more of your calls when we get back. 877-977-TXCN is the number to call, only in the 8 a.m. hour. And later on, we're going to show you some of my picks for new spring things from Foley's. And we have the boys from Cafe Italia in the kitchen. What are you guys up to over there, Scott and Tom?
Well, I'm using all the willpower I can not to drink this drink until you get over here. So, Tom, what are you doing?
I'm getting some tomatoes ready for my grilled shrimp salad.
Fabulous.
It's going to be wonderful.
We'll be with you guys in a little bit. We'll be right back. And we're back with Dr. Raul Rodriguez, and we're talking about fillers, like the new Restylane. Everybody's talking about that. And we have Debbie calling here, and she has a question. Hi, Debbie.
Hi, how are you?
Good. What's your question for Dr. Rodriguez?
Well, I've always had small lips, and I was curious about how much of an enhancement you can get with Restylane.
Oh, that's a good one.
What part of the body?
Lips.
The lips. Well, the lips are one of the primary areas where we actually use the Restylane. We can do lip enhancement, as you saw in the clip a little bit earlier, using a dental block. It makes it almost a completely painless procedure, and we can really make your face look a lot younger and restore the proportion to your lips that it may have had in years gone by.
This is me, actually, Debbie. Look at this. I had my lips done just the time, and it looks like it just kills, but I'm telling you, I didn't feel a thing. But
Nothing like collagen pain.
No. Oh, no.
No.
Oh, I don't know. I have never had collagen, and I never did collagen because I was afraid of having those big old puffy fishy lips. Because, you know, you see it done and it just doesn't look great. But I just had it done very, very slightly. But you like it for lips, right?
Oh, absolutely. And the thing that's really nice about it is that it lasts longer. It's easier to work with. It gives you a much more natural look.
Yeah.
I like for people to have a very natural look so they see the beauty of your face, not see the lips coming around the corner.
Not the big lips.
Exactly. But the Restylane really allows me to do that.
Okay.
And I can tailor it to the patient's desired shape and contour and size.
Love that.
A lot of people bring in magazines that they tear up and say, I want my lips to look kind of like this.
Right.
And we can accomplish
Oh,
a lot.
that's fantastic.
with it that way.
Well, Debbie, thank you so much for calling, and we have a Prezi for you on the way. We've got some fabulous Frederick Fekkai hair products that I think you're just going to absolutely love. But thanks so much for calling. Okay, now the next one we have is Karen, who has a question. You have a question about Botox, Karen?
Well, actually, I was wondering what would be the best treatment for someone that's in their early 40s who has very fine lines.
Oh.
Okay. Well, that's great. That's a good question. The Restylane can be used for fine lines. I like to use it in conjunction with other treatment modalities. I like the mesotherapy and the laser because we can actually restore some of the tone to your skin that it may have had when you were younger, and a lot of those fine lines go away. And then whatever's left behind, we can plump up with the fillers to really give you a nice, smooth, even look in those areas where you have the fine lines.
Oh, that sounds great. Have you had Botox before?
No, I haven't, but I was also interested in Botox. At what age would be a good time to start that?
It depends. If you're starting to show little fine lines already in the creases, like when you smile or when you raise your eyebrows or make a frown, then it's probably a good time to get started. I have patients in my practice that start as early as in their early 20s because they're already starting to show the little lines in areas of facial expression.
Oh, that's great.
Okay, thanks.
Thank you so much for calling. I've got a great little Prezi for you that I'll be sending. I've got some wonderful makeup, so I'll be sending that to you, okay? Thanks.
Right, thank you.
Thanks so much for calling. We also have Dana from Burleson with a question. Hi, Dana.
Are you there?
Dana, hey.
Yes. I was just wondering how often you can get the injections.
Okay.
How often?
Well, typically, most patients will get it done like every 9 months or so, 6 to 9 months. The duration of the Restylane just depends on the patient. And patients usually know, they'll say, yeah, Dr. Rodriguez, it's time to get a little bit more. And then just come in, we get you scheduled, and we keep doing it. The nice thing also about it is when we're using Restylane in areas where you have deeper lines, if we use it for, let's say, a couple of years, having periodic injections, the skin gets a chance to smooth back out, and a lot of those lines can be kept at bay for many, many years to come.
So, but the Restylane, you were saying earlier, it lasts like 6 to 9 months.
It lasts 6 to 9 months.
So you really don't
right.
have to go back very often.
Not very often, no.
That's really good. Even though it doesn't hurt, I got to say, as kind of gross looking as that video was, it didn't hurt. I loved it. I was like, can't feel a thing.
Right.
Which we're all about the no pain.
No pain.
Dr. Rodriguez,
No
thank
pain.
you so much for being with us.
Well, it's my pleasure, Maddie.
And it's
Thank you for having me.
rejuvenexmedical.com for information. It'll be linked to my website
Correct.
at txcn.com/Maddie.
Great.
And so people can find you that way. Always a pleasure.
It's always a
Love
pleasure to be
having you.
here.